If you're struggling with the concept of fluctuating capacity, then this video is for you. So what is fluctuating capacity and why does it cause such problems? Well, fluctuating capacity is a term that really refers to a situation where a person's decision making varies from time to time. And when we talk about time to time, it tends to be over a short period of time. So for example, they might make one decision in the morning and then in the afternoon come to a completely different decision about the same thing. And the reason this causes difficulty is because as practitioners, we sometimes don't know which decision we should be going with. Which one did they really mean? Did they mean the one that they said in the morning, or did they mean the one they said in the afternoon? Now, I think it's important that we dispel a myth straight away. Fluctuating capacity is a term that is an interim term. Okay, it's not a term that we should be using as the final outcome, because ultimately, when it comes to a decision, you either have the capacity to do it or you don't. So really, fluctuating capacity, we can often reframe to say they've got fluctuating decision making and we need to know whether they have capacity to make that decision. So, how do we start to deal with fluctuating capacity? Well, there are a number of key things that you can check. The first thing you need to be checking is the question too broad? And what do I mean by that? Well, some of the questions that we often assess for or get asked to assess for are quite broad in nature. For example, property and financial affairs or health and welfare. And within that decision or within that particular topic, there are lots of smaller topics. And it might be, for example, that what they're struggling with is budgeting. And so rather than assess for the whole shebang of property and financial affairs, let's just do budgeting. And that way we can start to cut out any areas that they may be having difficulty with, but that's not actually directly related to the specific decision we're looking at. Okay, so we've honed down our specific decision. We've narrowed it down to the finest point. The next thing that causes confusion and sometimes leads to this concern as to whether a person has capacity or doesn't, and whether it's fluctuating, is have you got the right threshold of understanding? Now, I talk about the threshold of understanding in other videos, but in brief, the threshold of understanding is what does a person need to know in order to make that specific decision? Now, obviously, the threshold of understanding varies from decision to decision. So what I need to know to make a decision around property and finance is different to what I need to know to make a decision around health and welfare. So if you don't know what they need to understand, and if you don't know that, it becomes very difficult to ascertain whether the other person knows that information. Okay, so we've honed down the specific decision. We've got the right threshold of understanding. The next thing we need to think about is what type of question is it? Now, when I say what type of question, there's a bit of case law. It's called ABC versus XYZ. It's in 2012. And those of you who've seen my other videos will know it's one of my favourite bits of case law. And it's really, really useful when it comes to trying to determine or unpick this fluctuating capacity issue. Because what that case law says is that, look, we've got two decisions, or two types of decisions. We have your macro decisions. So these are ongoing decisions where at any point in time they might need a sudden or unforeseen intervention. And the judge said these are things such as property and finance, health and welfare. And then he contrasted those what we call micro decisions or one-off decisions. So, for example, should you decide to watch this video? Should I have a cup of tea? What should I have for breakfast? A will, making a will is considered a one-off. A lasting power of attorney is another example of a one-off. And so what the judge did is he contrasted these two types. And he said that if it is a one-off, then very much you can take the evidence that's provided at that assessment at the time they're making that decision, they're signing that piece of paper, they're doing whatever it is, signing the lasting power of attorney. So, but if it's a macro decision, then this is an ongoing decision. And actually we can't just use the evidence of the assessment at the time, but we have to take a broader, a longer view. And that means that where we get our evidence from changes. So, how does it change for macro decisions? Well, With a macro decision, because we're taking that longitudinal view, we start to think, okay, so what were they like before? So what have they been like over the last month, the last 2 months? What have their actions been? How are they behaving? Is what they're telling me now congruent? Does it respond? Does it follow? Does it match what they've been doing? And it might not only be last month, it might be this morning. It might have been yesterday. So for example, they might tell me that they never ever want to see their son again, but actually that morning they're phoning him up and asking him to come round. So of course there's that incongruence there between the two. So we start to look at the broader, longer term picture. We really start to examine our third party evidence. So what do the care notes tell us? What do the other professionals tell us? What do family members tell us? To get that history. Now, we don't need to be 100% sure. Okay, there's this thing called the balance of probabilities, and again, I've talked about this before, but it's one of the vaguest legal concepts that I've come across. Basically, you cut your brain in half, and 51% of it says what? So we only have to be 51 or more percent certain in terms of whether a person has the capacity to make the decision or not. So what's the evidence we're getting from the third party? How is that leading us? And what we do then is we say, right, so they are in the morning making one decision, in the afternoon making a different decision. I can't take what they're telling me now as the final word. I look at everything else and I then say, right, going forward, do I think the majority of the time they're going to be able to make this decision or not? And if the answer is not, then we say they lack capacity. Okay, and so that gets rid of that whole fluctuating issue if it's a macro decision. So what about a micro decision? Well, a micro decision is this one-off, where what they're telling me at the time when they're sat there, I can take as actually a snapshot of their capacity. And so that means that I'm then looking for different things, and I have to have different considerations, because I have to make sure that at that point that I'm assessing the person, they are at their best. They are the best that they can be, so that I can get as clear an idea as possible as to their capacity. So, for example, the first thing I'm looking at is this the best time to be assessing them? So, for example, I once saw a lady who got out of bed at about 10, had a breakfast, then had medication that knocked her off to 12. She was okay, 12, had a lunch, then about 2, 3 o'clock had more medication that knocked her off until the afternoon, and then about 5, 6 o'clock she became increasingly confused. And so actually, if I'd seen her at 5 or 6 o'clock, that would have been the wrong time. If I tried to see her at 9 o'clock in the morning, that would have been the wrong time. So I had a very short window when I saw her after lunch to try and get her at her best. So if when you're seeing them isn't the best time, you have to ask yourself, can I delay this decision? Now, sometimes you might not be able to delay that decision. Okay, it might be a deathbed will or something like that, and you just have to go with what you've got in front of you. But if you can delay it, then you should do. One of the other things that I always consider is kind of what's the natural cycle of their illness. So are they better in the morning? Are they worse in the afternoon? What's the effect of the medication? Are they in familiar surroundings? So we know that if a person is confused or likely or prone to confusion, then taking them and putting them in unfamiliar surroundings is going to exacerbate that. So we need to try and ensure that not only are we seeing them at the best time, but that we're seeing them in a place that they're familiar with. And once we've done that, and then we've done all the other stuff like the supported decision making, so giving them all the tools, giving them the information in the best way that they can understand. Once we've done all that, we can then fairly confidently say, this is a micro decision. I've done everything that I can do to support her or him to be at the best that they can be. Now, how are they presenting to me right here and now? For this one-off decision, that's the snapshot I'm taking. So again, you then rule out that fluctuating capacity. So can you see that if we start to think of fluctuating capacity as an interim label rather than the final outcome, we can start to view it slightly differently. And we really need to have this, is it a macro, in which case I take the longer term view, or is it the micro, in which case I take that shorter term view? So look, I hope that has helped explain fluctuating capacity and how we unpick it, how we get to that non-fluctuating decision. If you've enjoyed this, then please do like and share and subscribe, and feel free to watch some of my other videos. If there's anything you'd like me to talk about in terms of capacity or even mental health or assessment per se, then please let me know and I'll make you a video about it. Thank you very much.